The current COVID-19 spike has staff at Enloe Medical Center worried about caring for those suffering from the virus. They tell Action News Now reporter Janelle Pedrosa this is the worst it's been since the pandemic started.
Enloe Medical Center is seeing a surge in COVID-19 patients. I talked to Enloe's chief medical officer, who says the spike is stretching them to their limits.
This wave is now worse than the winter wave.
In the past month, Enloe saw about 600 COVID patients come into the emergency department. Right now, 69 people in the hospital with COVID, 6 in the ICU, and 3 on ventilators.
We have more patients in the hospital. We have more patients in isolation in the county. We are not out of this wave yet. September will be a long month.
The hospital has more ICU beds available, but that may change soon.
The impact of COVID is hitting all the different regions in California really hard. The San Joaquin Valley is having to transfer patients out of their region now to other regions such as ours because they have fewer than 10% ICU bed capacity.
Dr. Nelson says with the spike, the hospital is reinstating parts of its surge plan from early on in the pandemic. That includes separating patients who look like they have a respiratory illness from those who don't. The hospital also decided to decrease their elective surgery scheduling again.
We want to preserve our ability to take care of patients who have an urgent, emergent need.
With Labor Day weekend here, health experts are urging everyone to keep gatherings in small groups. In Chico, Janelle Pedrosa, Action News Now coverage you can count on.
And right now, more than 80% of patients currently hospitalized for the virus at Enloe are unvaccinated.